Namaste viewers, welcome to our channel again. Apologies to keep you waiting so much. Thanks for staying tuned. It's like after 1 year we are meeting. Hi, I am Dr. Bhavesh Balala, physiotherapist, licensed physiotherapist practicing in the state of Maharashtra, Mumbai. Our topic of discussion is brachial plexus injury part 14. What is brachial plexus injury part 14 meant for? We are going to deal with lower plexus injury site. The lower plexus injury means C7, C8, T1 level of injury. It can be due to compression, it can be due to avulsion, due to traumatic conditions. So the deformity specifically in the lower plexus injury we see is a claw hand. This kind of thing you might have been facing with. So how to rehabilitate this problem? Like you are able to do some flexion but unable to do the whole extension. So how to gain the whole extension? So before gaining this whole extension of the fingers, we need to also take on the wrist, the forearm muscles. So our previous video, I think part 4th it was, we had been seeing some exercises with flex bar. You can watch out the previous videos too. If you go through the chronology from part 1 to part 13, it's going to help you immensely. Coming back to our point. So if we want to improve our finger extension, we got to have some good wrist extension and flexion movement. So if we want this good flexion extension movement, we'll be able to easily free up the distal portion of the hand, the fingers, the DIP, the PIPs. So we'll be dealing by strengthening the forearm muscles, the wrist movements with some pegboard exercises, with some grip, improvement exercises. More of it will be eccentric development. Eccentrically we'll be trying to develop following a CKC chain program. So let's not talk much. Let's proceed with the job. Okay. So first exercise, we'll be placing two stands apart from each other. This is called as pegboard. I don't know what name should we give. Let's say donut to this. Okay. So these are the two steel stands. We'll be putting the ends of the stands of the spring. So these are springs. These are two steel stands. Just adjusting. All right. Over here, I'll be holding this donut this way, a proper grip, and then moving my hand at the edge of the pegboard, holding it tight and just supporting my end of the forearm, moving this down and slowly taking it up, down, up, down, up. You might require someone's support over here in this particular exercise for supporting this, for supporting the ply. Many of you might face grip issues, so you can apply a strap, okay, a Velcro strap. I've just taken this strap, a random one, so that just to give the sense of the presentation, or you can say the placement of the Velcro. So I'm just randomly applying it. Okay, I'm just randomly applying it this way. Okay, so like this way. So you can apply a good length, a lengthy strap, crisscross or like that, completely winding with the donut, and then just doing the movement front and back, down and up, down and up. So this is one of the first exercise with donut. Second position again will be holding this way, the other way around. Okay, this way. Okay, holding it properly and just moving the donut down and up, down and up. You might require someone's support, as I say again, while assisting in this movement down and up. In the previous exercise also, if someone helps you out, it will be better, or you might take your own assistance in this movement. Again, this strap will help you very much, kind of applying at the donut with your hand in this particular exercise. So this helps you in the movement of the wrist, and if you do it in a very controlled manner, yes, it's going to improve your control as well as strength and the length together. Second exercise will be done with a stick, a small stick. So over here, I'll be placing the ends of the steel stand. Over here, I'll be placing a stick this way. The two ends of the stick placed in this stand, particular stand, and the third one I'll be using over here. Now my affected side is right side. Okay, let's keep it left side so that visibility becomes little easy. Left side. So there are different, holes over here. So you can place at any different level. So if suppose I'm keeping it more near, it becomes very easy. This is a little tough. This is little tough. This is more tough. I'll just keep it over here just for, kind of presentation stuff. Holding the stick this way. I'll support my thumb and the forearm this way, and just fold and slightly open. Fold and slightly open. Okay, this is the second exercise. So over here, I'm just going to kind of snap it. It can happen if you do not hold it in proper control, you might snap it. So kind of don't do it very, fast. Do it very gently. So if you're holding this, just kind of slow movement, slow movement, and in a very controlled manner. All right. This is the second exercise. Third one. So this kind of got down. It should be usually up, both of them, in this particular exercise. Okay. Next one will be with the ring. So this blue ring, which I've got over here, will help us in the thumb movement. So one end of the ring over here, second end over here, placed, just attached in your thumb. Now here you have to just take your hand a bit front, support your hand properly over here, just move your thumb in and return back, in and return back, in, return back. If you want to have more resistance, just take this ply aside, take your hand over here, and you can just do this play. Okay, seemingly better. All right. Then you can do it with the individual finger, like keeping the stand over here. Now this is the thumb portion. These are the forefinger portion. So I'll just support this thumb portion over here, right? And I can do it with 2 fingers or 3 fingers like that. Okay. So I'm just supporting all the fingers together, first of all. And then I can do it, let's do it with individual finger. So I'm supporting all my fingers. So this is one. Okay. Then I can put my second finger, supporting my other fingers. Okay. Supporting my other fingers. So flexion extension, you see, it's become so easy. So third and fourth finger you can do. Next exercise, again, placing the steel stand over here, supporting the thumb end of this ring in the steel stand. Now I'll be just put the finger ends of the ring in all these fingers, and I'm just going to put this thumb region over here inside the steel, a bit properly fixed. This is also properly fixed. Now I'll just push my hand a bit front, supporting my thumb properly over here, and just do flexion extension movement. So I'm just flexing and just releasing. So over here, this rubber, the elastic region, the elastic portion, it just tries to pull your fingers back, So gaining finger extension eccentrically helps very much in this particular exercise. So just flex, and if you just loosen it, so the elastic portion is just pulling me, it's just assisting me in the movement. This is one of my exercise. If you want more resistance, just take slightly more forward and then just do this movement. It's better you take someone's support. It becomes easy for you. All right. These are the few exercises which we have done for finger, for thumb. Also for thumb, if we want, we can do it this way. Let's do it for our, let's say, left side. Okay. I'll place it over here. Kind of, this way. I can even do this way. So just taking my thumb inside and outside. So this helps me again for the abduction. If you want a little more precise movement, you can place your shoulder to elbow to forearm, everything in almost the same straight line, and just pulling in and releasing, pulling in and releasing. So the moment you pull and just release the elastic part, it just pull outside, kind of getting a good abduction movement. All right, that's perfect. So these are the exercises which you can do. These are for the education purpose, the awareness purpose. It's not meant for treatment, definitely not meant for treatment. You have to meet your nearest physiotherapist, a specialized one who deals with brachial plexus injuries, who have got good experience in treating brachial plexus injuries. Hope this information helps you around. And yes, I hope you'll do your regular exercises. Stick to physiotherapist, your near physiotherapist. Do regular exercises and just have patience in recovery, because this takes a bit of long time. Nobody will be able to tell you, but yes, it's about process. If you be in the process, if you believe in the process, just do your exercise religiously. It's going to help you immensely. Thank you.